Xerox Healthcare has been rebranded as Conduent. It is perhaps the quietest $2 billion healthcare company today, but that hasn't stopped in its acquisitions, innovation, and growth. This is not your father's copying company anymore. With us today is Rohan Kulkarni, Vice President for Healthcare Strategy at Conduent. He's led the charge to take many of their portfolio companies and create a connected healthcare ecosystem around the consumer. He's locked, loaded, and ready to share it with us today, right here on Red Hot Healthcare. Let's go.
3 alarm at 21 and north. All engines respond.
This is Red Hot Healthcare. Interviews with today's leaders and all the news that matters. Here's your host, Steve Ambrose.
Hello and welcome to the show. I'm your host, Steve Ambrose, and you can subscribe to Red Hot Healthcare on iTunes, Stitcher, and other podcast directories. And we love to hear from you. Just send your comments or questions to steve@redhothealthcare.com or hit me up on my Twitter handle, PolymathSteve. Today's show is being sponsored by Medisend, any size medical office, facility, or hospital. Let Medisend analyze your current medical waste services and fees. You can remain with your current waste vendor, and Medisend will lower their ongoing fees to you. Medisend gets paid only if you save. Or switch your medical waste services to Medisend. They often save new clients up to 30% or more off current vendors, and fees remain level from year to year. Just go to redhothealthcare.com, fill out a few fields. Guys, I can't do any better than this. Medisend is good people with great intentions. Save with Medisend today. And now, we're ready for the show. Rohan Kulkarni is Vice President for Healthcare Strategy and Portfolio at Conduent, rebranded from Xerox Healthcare Business Group. He brought a business process outsourcing background to the forefront of a services company that needed new strategy to jump into a new era of healthcare. He has an extensive background in engagement from cyber, Convergys, and Booz & Company. Rohan, welcome aboard Red Hot Healthcare.
Thank you, Steve. This is very exciting. I really appreciate the opportunity to chat a bit with you here.
A lot of people have no idea about the size and holdings of what had been Xerox Healthcare Business Services. Now it's been rebranded as Conduent. So we're talking about a $2 billion organization, and it's growing. If you could, on a very high level, Rohan, please break down how Conduent has changed its healthcare strategy perhaps over the last 12 months.
Steve, I would not say changed as much as evolved as has the industry. So as Conduent becomes a brand new independent company on January 1st, 2017, we are more focused on the services aspect of a diversified industry. Specifically from a healthcare perspective, we are continuing to refine our outlook as we deploy the right types of resources in a specific direction. We have been preparing for our spinoff from Xerox, which essentially means we will not have access to certain expertise that Xerox brought, while at the same time we will have greater freedom to how we go about trying to solve very specific healthcare challenges.
And tell us how you played a part in that.
So I'd say strategy is a team sport, as you can imagine, especially for a very large diversified business as ours. A few things that I brought to the surface. The first one was recognition that we take a more sophisticated portfolio approach to developing our strategy, such as to be mindful that there is an inherent network effect of the portfolio that we should explore, which has led to our ability to connect the entire healthcare ecosystem around the health consumer, leveraging our healthcare portfolios. Secondly, I help translate that into our ability to solve cross-industry problems, thereby driving premium services with a much higher value proposition for our clients. And then lastly, we've begun to look beyond just the quarters, but more across the horizon and identifying where and what we want to drive towards, which will inform us better about problems we want to be solving, our M&A strategy, as well as new services and solutions we want to be developing and so on.
Right. When we're talking about the main healthcare segments of Conduent, what are we talking here about the healthcare segments that you service and work with? What are they?
So our clients include commercial payers, state government specifically for Medicaid services, hospital systems and providers, as well as a pharma and life sciences practice. We serve 19 of the top 20 managed U.S. healthcare plans.
Wow.
9 of the top 10 pharma plans, pharma and life sciences companies, some 20 plus states where we are fiscal agent, as well as over 2,000 hospitals are our clients.
How come you're so quiet? I feel as though, I feel pretty well versed in what's going on in the industry, yet it just seemed like to me when we started talking that I had no idea that Conduent had this kind of reach.
Well, I think that has to do with the fact that we are a services company. As a consequence of that, while we are central to our clients being fairly successful, it's one of those parts of the industries where you go about trying to do what you do with a fairly low profile.
Are you looking to be more in the forefront, though, as Conduit starts to roll out the first of this year? Are you looking to sort of build that name up to greater recognition?
We certainly will have to do that because, a lot of our clients are familiar with the Xerox brand. Conduent is a new brand, so we will certainly have to work our way up in terms of trying to drive greater awareness of Conduent, the brand. But generally speaking, the approach that we're going to continue to take is that as long as we are fulfilling and providing a value proposition to our clients that is central to what they do.
Okay, so I'm a strategy guy. Let's just take commercial payer, government, provider. So we're going to wrap in, hospital health system, and then pharma life sciences, those 4. Break down the core strategies, if you could, around these 4 healthcare segments.
Certainly. So to your point, that has been our go-to market, and that has taken a fairly traditional industry view based on how you describe the 4 segments we play in. Now, as we become Conduent, we have and we will continue to assess our strategy and drive the right level of adaptation we will need to be able to meet the needs of the healthcare transformation. Now, let me give you some very specific examples to make real, because in many ways, the other thing that I am attempting to do within the organization is to drive practical strategies versus just an academic view of what a strategy could look like. Now, first one, as a services company, we recognize that the traditional paradigms of transactions, i.e., you provide a service and we collect a fee, is beginning to disintermediate itself, especially with the shift towards value-based purchasing. This lends itself to how we are beginning to think about our services and solutions we bring to market, which is to focus more on the outcomes and less on the transactional value itself. Now, that is not to say we won't be doing any transactions. In fact, they will continue to drive the foundational level of our delivery. However, we will begin to shift towards identifying very specific outcomes and developing solutions to achieving those outcomes, as we have done with the health outcome solution. Another example. There are also certain underserved parts of the healthcare industry. And when I say underserved, they're underserved from a business process outsourcing and services context. And some of these underserved parts could include the accountable care organizations, Medicaid managed care organizations, or even some wellness organizations for that matter. And they're beginning to play a pretty vital role in the entire healthcare transformation. We believe that we have the right set of solutions for these industry segments that you will now begin to see us collaborate with more and more. So essentially, we will focus on maintaining our base while expanding into other areas of the market while enhancing our portfolio as we go forward.
The company won the Fierce Healthcare Innovation Award in 2016, and they won it for their population health and patient engagement solution. I love patient engagement, as we've talked off air. And that was done at HIMSS 2016. So that was a pretty big award that you all won. Tell me a little bit about this population health management technology. First of all, was it acquired as part of your portfolio, or did you develop it from the ground up, or was it a combination of both?
So Steve, health outcomes solution is really the population health management offering, where we took a portfolio approach to the solution. We have essentially connected a variety of our capabilities within the portfolio to develop a more comprehensive and integrated solution. It's essentially a full lifecycle service solution for population health management.
In other words, since you have ACOs and other organizations that are now going to be taking on risk, is what you're saying that your product is geared and specifically tuned in to whatever that customer's risk portfolio is at and what they're expecting to take on in terms of risk, and then it's sort of geared towards blending with that?
Precisely. I don't think I could have explained that any better than you just did. Very specifically with Medicare ACOs, for instance, where they have some 32, 33 quality attributes, and they've got financial benchmarks and certainly a risk profile that they need to meet with track 2 and track 3, for instance. For such Medicare ACOs, our kind of solution is extremely perfect, I would think.
A lot of people don't know this, but Conduit, which up until the beginning of 2017 is still going to be Xerox Health business unit, has had more than 4 decades of healthcare program administration. It's, from what I read, it's certified in 32 state Medicaid programs. No health segment under 60 is sicker than the Medicaid segment of our country. I mean, you just look at Medicaid and chronic disease, and they're not always a perfect match, but there tends to be high chronic disease in a lot of this population. What is the strategy that Conduit utilizes or will utilize to implement the new population health management outcomes program you've developed throughout the Medicaid segment?
The set of services that we help states include Medicaid Management Information System. So it's an end-to-end platform that we provide, as well as the services wrapped around that, which essentially help states make better decisions, ease their administrative burdens on providers, and improve access to care. So it is our intent to continue to leverage that, help balance those savings and quality of care. By identifying ways to work more efficiently, we can essentially transform information into intelligence, which you can then use to reallocate your resources and improve the business of health. Now, the other thing that I'll also call out is we're beginning to see a lot of the states are now beginning to move more and more of their Medicaid beneficiaries to managed care organizations. And we think our population health management solution will continue to collaborate with the MCOs and customize it based on their very specific needs, be it financial, be it health outcomes, be it socioeconomic or others.
I know you have an extensive background in engagement, Rohan. I mean, through your other positions before you came to Xerox, which is now becoming Conduent. So how have you brought your background in engagement and maybe some of the facets of engagement into Conduent's current strategy and maybe with their current portfolio?
So at Conduent, we're always asking ourselves, what does this mean to our ability to impact consumer engagement across these 3 different dimensions? As in, doing what we do, will it help our clients improve their consumer awareness? Will it enhance omni-channel delivery and support? And are we able to upgrade the deployment of our capacity to optimize follow-up? So this kind of a structured approach is helping us ensure we're focusing on the right things for our clients and investing in the right places as well.
And now a few words from your host. I get email from listeners that want to know what I do. Hey, I'm a consultant that works in 3 areas: patient engagement, influencing healthcare consumers, and persuasive communication. Don't think for a second that just because you created or use some whiz-bang technology to lower chronic disease rates or capture patient-generated health data, that patients are going to raise their hands, open their eyes, line up, and get with your program. If you're treating patient engagement as a head-nodding, getting them to agree tactic, don't be surprised when they close you off. I was a provider for nearly 10,000 patients. I saw as many as 50 encounters a day, many of them self-pay and properly engaged on long-term care management. I also served in strategy and customer communications for a tech company serving millions of needy customers across the country. I know what it takes to reach patients, consumers, and the people that support them. I'm happy to chat. I'll let you know if and how I can help. Just email me, steveambrosucla@gmail.com. And now, we're ready for the show. 61% of U.S. adults are amenable to doing telehealth consults for non-urgent care, but only 16% have used any sort of virtual services to date. And I want to ask you, do you think the lower number, that to me, which is surprising, do you think the lower number is just due to the time needed to adopt to the technology?
Yeah, I'm not entirely sure as to why the adoption has been slower, but I do think there's an expanded interest now as broadband speeds improve. In fact, we know that based on our research, 77% of those surveyed told us that they're actually looking forward to virtual healthcare. People have come to expect an anytime, anywhere paradigm, the same type of experience they tend to enjoy with other industries, be it retail, travel, or even banking for that matter. And we're clearly on the edge of that major expansion in virtual care. And the other couple of things that I'd also call out is that more and more states are making it financially feasible for providers to offer telehealth. And so that will also add to the improvement in adoption.
What are the challenges and maybe some of the areas that some of the barriers that you see to Conduit's growth in the next year or two?
Sure. The challenges that's facing the entire industry for that matter right now is a bit of apprehension after the presidential elections. I think we're all still trying to figure out what the new world order would look like and whether that would drive additional health IT spending or will it actually decrease? And more importantly, what will happen to some of the legislation that's been passed over the last several years, whether it be MACRA or ACA. And I think this level of uncertainty is going to be a challenge. The other challenge is to do with data silos. We touched upon this a little earlier. But unleashing data is so important, and it's not very uncommon for us, especially at Conduent, to ask a client for their claims data that they actually own, right? And for it to take them months and months to access and share it with us. We all collectively talk about interoperability, but interoperability can't be realized until we start to have data flowing back and forth, obviously in a safe, secure manner. So I'd say our responsibility at Conduent is to illustrate a clear value proposition for unleashing this data. Our clients' responsibility is to understand that their own data, infrastructure, and governance, and that the government's responsibility as the third wheel here is to think clearly about creating incentives that allow for stakeholder alignment so data can flow in the right directions.
I know that we talked about Conduent being more back office, but I'd like to know where you stand with innovation. In particular, maybe disruptive and transformational innovation. Is that part of Conduit's mindset moving forward? Or are you seeking to grow Conduit through acquisitions and partnering in its portfolio and maybe staying more into a greater market share growth into commoditized markets?
I'd say both. We bring end-to-end capabilities in the middle office and the back office to a great extent. And oftentimes we also recognize that if we are able to connect them, we are also able to drive a much higher value proposition to our clients. We do always scan the market for other great players that can make sense to partner with us or even acquire sometimes. But then even our organization has a group of around 250 researchers and developers that we can always pull in internally to develop such technologies as well.
Rohan Kulkarni, Vice President for Healthcare Strategy and Portfolio at Conduit. We thank you so much for taking the time with us today. It was a privilege and a pleasure speaking with you, and we look forward to great things from the company and hearing about great things with you as well.
Steve, thank you. I really appreciate the opportunity. This was fun chatting about all things healthcare, and I share your enthusiasm and optimism for healthcare to continue to improve in our nation. Thank you.
You've been listening to Red Hot Healthcare with Steve Ambrose. Subscribe to us on most major podcast directories. For media or business inquiries, reach out to media@redhothealthcare.com. Thanks for listening. This is Denny Colonna. We're out of here.